Recovery tips for a C-section. Okay, the first thing we're going to talk about is your pain medication. When you go home, you should have been prescribed Motrin or ibuprofen. Usually it's either 600 milligrams or 800 milligrams. You can take that every 6 hours. The next one is Tylenol or acetaminophen. You can take 1,000 milligrams every 6 hours. So what I would recommend doing is alternating those. So you take Motrin, and then 3 hours later you take ibuprofen, and then 3 hours later you take a Motrin, and then 3 hours later take a Tylenol. So that way there's something constantly in your system. And then you should be given a prescription for narcotics, whether it's oxycodone, Percocet, Norco, any of those. Some of those do contain acetaminophen or Tylenol. So make sure you calculate how much Tylenol you are taking and that it doesn't exceed 4 grams in a 24-hour period, or 4,000 milligrams is the conversion there. So that is for your pain medication. The next one is for bowel movements. So your first bowel movement sometimes can take 3 to 4 days. So don't panic if you haven't pooped yet and it's only day 2. But what you can do to help that situation is take stool softeners like Colace. You can take Miralax. And then one thing that's really disgusting, but if you're in a very desperate spot will work, is warm orange juice mixed with prune juice and Miralax. Gross, yes, but it will get the bowels going. The next one is your gas pain. So take Gas-X or Simethicone. That will help with that. And then the abdominal binder that they should give you in the hospital, if they didn't give you one, or if you're in the hospital, still ask for one. You can buy them online as well, but that will help allow for some counter pressure when you're up and moving around. If you're gonna cough, sneeze, laugh, make sure you have a pillow, you push it in on your belly when you do that, and that will help do the counter pressure so you don't have all those forces going out on your incision, which can make your pain worse. The next thing is when to call your doctor. So if you have a fever that is over 100.4, call your doctor. If you have persistent nausea and vomiting, you're not able to keep food down, that's also not bad. Or excuse me, that is also bad. The next thing is if you can't pee. You're sitting there, you're trying, it's just trickling out. Urinary retention is very common after surgery, so please call for us. And if your pain is not controlled and you're doing the above regimen that I talked about, or your incision looks infected, those are all main reasons to call your OB/GYN or your doctor to see if anything else is going on. And this is also just kind of goes towards any surgery as well. And I hope your recovery is going great and you are getting all those baby snuggles.